And today we're going to work on Alec. And Alec, you've been coming into the office for about 6 months.
About 6 months now, yeah.
Yeah. And his initial complaint were headaches, shoulder pain, upper back pain. Alex is pretty active. He's been training to go into the military. As you can tell by the nice haircut, he's actually leaving for officers candidate school.
A couple weeks now, yeah.
A couple weeks, yeah, in September, I believe. So, how are you feeling overall? How's the treatment going?
Treatment's been really good. It's done a lot. It's been a little bit of a slow process just to slowly ease the tension that's in my back and upper back, and but it's been good. And one of the things he's been doing is scraping, and that's been relieving a lot of the tension there.
Yeah, scraping is called a couple of different things: myofascial release, instrument-assisted soft tissue manipulation. Some people call it GRAST. And we've used different tools along with some cupping, and now today that's what we're going to do. We're going to do a little bit of demonstration, show you some of the areas and how we work, and we'll run through a treatment, and we'll adjust him, and we'll get going. So Alec, go ahead and have a seat right there for me, please. Okay. Oh, go ahead and just face it away. So you'll need to take your shirt off if you don't mind. He actually knew that. He forgot. No. So, let's do a couple things. So, Alec, go ahead and look straight ahead. You really just got it cut, didn't you? Mm-hmm. Yeah. So, go ahead and bring your arms out the side, and then bring them out this way. Go ahead and put them up over your head, palms together. Okay, now back out again. And you feel any restriction?
No.
No? Pretty good today? Mm-hmm. Bring that back down. So, his normal area of chief complaint is usually his lat here, the levator scapulae, this area, along with some rhomboids. Like, that's a nice big knot right there, isn't it?
Yeah, right there.
Yeah. This is a common one. The mid-scapular line injury, a lot of whiplash things. This isn't what actually is causing this particular one, but he did a lot of pull-ups, a lot of overhead work for the Marine Corps for training. So today what we're going to do is use this tool. It's stainless steel, and first of all what we're going to do is pass across, and we're going to find if there are, where the trigger points are. Right there I can feel it catching. You feel it there, Alec? Mm-hmm. Yeah. Now see that there's a little red dot there? What that is histamine coming out as we start to break up the adhesions in there. Like I say, we've been working on him for a while. He's a lot better today than he has been in the past. Because this would have, even a little bit less work than this really would have lit this up. You would have really seen a lot of red. So then we're going to work up into the shoulder area here, getting out. Not too bad today. A little bit right there. Is he grimacing?
Oh, a little.
Little, yeah. So there is some tenderness. It does cause some pain, but right there you can see where we start to get that trigger point. Now, one of the things I see, we're going to bring it, kind of stretch that muscle out a little bit. You can see there, and actually I can just feel it breaking up underneath there. You can follow that down there like that. There we go. So massage therapy does a lot, but it really doesn't get in there and break up the adhesions. And the myofascial adhesions is like similar to cheesecloth. It wraps every muscle, and those adhesions get bound up, and they start creating some problems. So right here, this is a common area for the shoulder, the teres. So it really helps with restriction. Yeah, there you go. You can see right there where it's showing up there like that. So what we want to do though, once we get that start to break up, we want to come over the top with some cupping. And the reason I want to do that is we're putting pressure in, and this is negative pressure. This helps break up the adhesions more and get circulation going into the area. How's that feeling?
Good.
Good? Mm-hmm. Go ahead and move your arm around a little bit. I want to put a little bit of motion in there. As you can tell, I can vary, that's good. There you go. I can vary the amount of intensity that we want to put into this area. You notice it's getting a little bit redder, we get a little more blood flow, which is good, because that stimulates the healing. A little tender there? Yeah. As you work it a bit, you need to make sure you have plenty of lotion on the area. So we'll check this other side, because it's a common situation if you have it on one side. A lot of people complain about pain between their shoulder blades. Probably the biggest thing I hear in my office of areas is between the shoulder blades. So we're going to start with a light, kind of light work, desensitize the area a little bit. And then, right, there we go, we're getting a little bit. Is that alright? A little bit higher on this side.
Yeah, it's a little higher in that area.
Yeah. Just see. How many pull-ups were you doing? Do you do a day?
Upwards of 50.
50? Yeah. You get it, see how it's starting to turn red there? This is actually probably worse than the other side now that I get working on it. It's a bigger trigger point. And you're right-handed?
Mm-hmm.
Yeah. You see there, we're getting it. The way the muscles go, the rhomboids actually go this way. Sometimes going across the muscle fiber actually helps break that up a little bit more. So do that. Apply that. Some of the common cupping, if you saw the Olympics, you'll see that they'll just leave it on. I prefer more of an active style. We can do static, especially if you want to just sit on the trigger point. Like I say, this really gets things to loosen up. That's really pulling, isn't it?
Mm-hmm.
Yeah. You okay?
Yeah, let's loosen things up.
You see the cup kind of bends. We just release the pressure there. Yeah, this thing is still in there. This is going to take some work. When Alex first came in, I mean, his back was just a train wreck. And from doing all the lifting and the exercise, he was having a lot of headaches because of the pulling with the trap and the lat and the levator scapulae, which is always fun to say. There we are. Let's work that just a little more. Do some direct pressure. Oh. Just feel that break up underneath there. Alright, now maybe go ahead and move your arms over your head again. See how that feels? Does that feel a little looser?
It is a little looser.
Definitely.
Yeah.
So, yeah, that's just, part of the way to get that to open up and move a little bit better. So we're going to have him jump in on his tummy here in a second. I'll go ahead and lay on your stomach there. Take a look and see what's going on. He's pretty square. One leg's a little bit off, not bad. He's a pretty healthy patient. Yeah, so you still got a little bit there. Not so much on this side. Okay, take a deep breath. Oh yeah. Oh, that was nice. Slick on this side. Work that muscle out a little bit more there. Alright, so you lay on this side. I'll put some motion in his low back. Alright, go ahead and look right over that shoulder. There you are. Oh, that was nice. You set it up right.
That was a good one.
Alright, let's get this side. Shoulder. Oh, I'm good. Alright. Okay. So, go ahead and look left and right for me. Back down. And let this ear fall right there. That was nice. Oh, that. Perfect. Alright. Now look left and right. How's that feel?
Well, this are pushing on this side.
All right, good. All right, there you go. So Alex is moving a lot better. If you have any questions, give us a call. Back in Motion, 360-357-7585. Thanks.